Good afternoon, everybody. Thank you for joining us today. Welcome to today's complimentary webinar. Today we have with us Jake Tunney from Leap Orbit, who is one of IMHIP's trusted partners, and the webinar is going to be on a new roster validation tool that is now live on IMHIP's website, so I'm really excited to hear more about it from Jake. My name is Lindsay Artola, and I'm the president of Sage Health Strategy. We are a boutique consulting firm based here in Chicago, and we do a lot of operations and help out Sam on a variety of things with IMHIP, and I'm pinch hitting with her being out on maternity leave. So welcome and thanks for having me. As you probably know, IMHIP works with all the member health plans, state government, legislators, advocacy groups, and Medicaid patients to invest in and provide high quality health care that focuses on cost-effective, individualized care that helps residents of Illinois live longer and healthier lives. Improving healthcare is a never-ending job, and there's always room for improvement, and that's why IMHIP is always looking to members and industry partners to achieve better healthcare outcomes and care delivery systems. So we are excited today, as I said, to welcome Jake Tunney from Leap Orbit. Jake is the Director of Payer Solutions at Leap Orbit and oversees Convergent, which is an automated provider data management platform. Convergent automates the integration and enrichment of provider data to improve efficiency, ensure accuracy, and compliance with the No Surprises Act. And if you are a health plan or a provider, you know the importance of accurate provider roster and credentialing information for both providers and members. IMHIP initiated a strategic collaboration with Convergent to improve provider data exchange for MCOs, providers, and ultimately the members that we all serve. So Jake's prepared a presentation and he's going to do a demo of the product and is ready for your Q&A. But before we get started, just to run through a couple of logistics, everybody is in listen-only mode. And if you bring your attention to the control panel, which should be on the right-hand side of your screen, important to have that open because it's going to be the way you interact with the webinar. If at any point you have any questions or technical difficulties, please feel free to use the chat box or questions box to communicate with either me or Tierney Hammer, who is also on from IMHIP. We come up as either the, I think we come up as IMHIP admin / organizer in the chat box. So just feel free to send us a message. We'll be saving time at the end for questions. So please, as we go through the webinar, feel free to put any questions you have in the chat or questions box, and we'll make sure to address them at the end. If we see them come up during the webinar and there's an opportunity, we may interrupt you, Jake, and get those questions answered as we go along. And as always, we'll be sending out a post-webinar email that'll include all the materials from today's presentation. So without further ado, I am going to turn it over to Jake from Leap Orbit to begin our webinar.
Yeah, thanks, Lindsay, for that great intro. It's nice to be here, and thanks for having me. Excited to be presenting this new tool that we're live with now on the IMHIP website, and is now available for every provider group in Illinois to use. And I'll be doing a brief demo of that very shortly. But before I do, I want to give a little bit more background about why we're doing this and the importance of this effort here in collaboration that Leap Orbit and our product Convergent is initiating with IMHIP. So yeah, let's get started. So I think Lindsay already gave a good intro. I'm going to intro my firm and then a little bit more background on the IMHIP roster and its success, and why we think this is a really good opportunity to work together. Some of the typical challenges that we see in the market around rosters, and please take notes and like Lindsay mentioned, add questions in the Q&A because, we're always learning and gathering feedback. And then item number 5, the vision for the future. That's, I think today is really the first step that we get to discuss how we're initiating, and implementing this actual vision that Samantha and the IMHIP team and our team have come up together. And then we'll do the demo. So, yep, I'm Jake Tunney again, Director of Payer Solutions with Leap Orbit. Been in healthcare my whole life. Really love solving challenging problems in the industry. My firm, Leap Orbit, is really a data and interoperability company at its heart. We work with a bunch of different payers and healthcare organizations across the country, and our work touches more than 45 million Americans from Alaska to Florida. You might have been aware of our initial discussion with Samantha, where we did a webinar highlighting the success and really the steps that it took for Samantha to take to get this statewide roster in place. And she's seen things like improved accuracy for provider directories, improved claims first pass rate, and improved timeliness of data. And this model in Illinois, I think your state really is on the forefront of innovation when it comes to aligning on standards for providers to reduce provider abrasion. Because we hear, across the country, that's a big problem for provider groups. So we wanted to build on Samantha's success and give a tool that, continue to build on that and improve the outcomes that Samantha and IMHIP and, state of Illinois has already achieved. So this is a funny picture of a really disgruntled provider. Actually, we're able to use AI to generate this, so it's a little jarring, but it's not really a real doctor. But the common challenges we hear, they're really on both sides of providers and the plans. Providers aren't always seeing changes reflected in the online directory when they submit data. Providers get denials from providers who should be in network, already sent in the data, obviously wasn't integrated and reflected in the claim system or the directory. And sometimes it's kind of a black box. Providers are not sure if the roster made it through to the correct person who ends up integrating it with the rest of the systems. And then on the health plan side, there's still challenges there too, receiving data in the incorrect format, inaccurate data, etc. So what we've done is we've used our tool, Convergent, to essentially map to the current IMHIP roster to build on the success. But what I'm about to demo for you today is essentially taking that Excel spreadsheet that all of you are probably familiar with and turning it into and mapping it to our app. So the app is now a tool that all providers can use to essentially pre-validate their data before it's submitted to the MCOs. So that way you will know that your data is in the correct format that the plans are expecting. So what we expect to see out of this is improved transparency, a better understanding of what the validation rules are that the plans are expecting, and the outcome is, like I mentioned, improved transparency, streamlined operations, providers getting immediate feedback on the validity of their data, not waiting for any processes on the plan side to kick off. And I know the plans have a lot of different processes depending on the plan. And then also the plans get to benefit from ensuring that the data that you've sent them after you've run it through this tool is valid. So without further ado, I think the time is right to demo this. One thing I do want to mention too, if there are any plans on the call, this is one component of what Convergent does. There's another aspect to Convergent that I'm not going to demo today because it's a little beyond scope. But if anyone does want to talk about this, feel free to reach out. We have another component that essentially goes one step further. Takes the valid data in that we're receiving and essentially gives you the ability to enrich that data with trusted sources to improve the accuracy of that data overall. So, using the familiar, typical trusted sources of data, as well as some proprietary information, we're able to, per your business rules, essentially customize how you're enriching roster data. So things like Medicaid IDs, NPES specialties, DEA numbers, auto standardizing USPS addresses. So, we also can integrate with the Illinois impact file. So there's just a couple things I wanted to mention that, we could end up scheduling another webinar or whatever to go through that in more detail. But today we're just going to be focusing on this piece, the roster tool. So let's go over to that. So I was excited to hear on Friday that this link is now live on the IMHIP website. So we can probably drop this in the chat, this link, but it's pretty easy to find. If you go to the providers tab under Universal IMHIP roster, it will open you right here. So what you'll notice at the bottom are 3 key buttons. So the first is the one that we'll be demoing today, but they all work the same, but just use different data. So the first is providers, the other are group locations and facilities. So I have a sample set of data that I'm going to use this tool to check the validity of my roster. So what I'll do is I'll click that button and it will pull up a window or a module where I can drop my roster. If I don't have the headers, I can always click here to download those. But since I do, I'm going to drop here and drop my roster test. So folks are probably familiar with these types of tools in other apps. But this one's really unique because it's been fine-tuned and mapped exactly 1-for-1 to the IMHIP roster. So you'll notice the first screen gives you is a view, a sample view of your data. And as you can see, it asks you to select the header. So because row 1 are the correct headers, it's already defaulted to do that. So we're good to go here. But if not, if say your headers were in row 2, you could go ahead and select those. So you can toggle between those if needed. So now that I've selected those headers, I'm going to click next. Now the next step is really cool because what it does is it auto maps the data in your file to the destination template fields. And what you'll see is the columns in your file should auto map to the template fields. That's because they match up with those destination fields. If they didn't for some reason, you would see the request to select a column, and you'd have to go in and map that data to get your verification results back on that specific element. So, but I'll go through here and just briefly glance to make sure all my fields are mapped. It looks like primary specialty taxonomy was not mapped. So I want to make sure that gets in there. So we're going to make sure those things all map perfectly. I'm not sure why that isn't right now. It looks like that was already mapped to this field here, primary specialty taxonomy. So yeah, I'm going to move on, but it looks like, this is being fine-tuned, so there might be little blips here and there that we'll need to use your feedback to correct for. So if there are, feel free to reach out to myself with any questions on this, because we want to make sure this is right and working properly. But it looks like overall it looks good. So the next section here is your verification report. So this is the handy report that you'll be able to get and generate that will essentially take your data and bump it up against the standard IMHIP template. And if there are any issues, it will appear in red. So you can go through and see, okay, well, this date of birth date format should be in this format. So if you want to correct that, in the user interface, you can do that. So this was 03, 18, 19, 77. And you can see that that is now correct. Or what you can do is you can export the data grid in Excel format. So all of these errors, if you have any, will be then available outside of the UI where you can go and view these in Excel again and make the corrections. Most people who use this end up doing the first few rounds in Excel just because there does tend to be some issues or a larger number of issues initially. So things like date are obviously very off in this data that I'm submitting here. So you're going to want to go ahead and make these date changes probably en masse in Excel before resubmitting and checking your data again. And this is a great view in Excel for all of the potential errors in the file. So this is really the end result of your report. Once you can make all of those corrections, you can go ahead and then resubmit and check to see if you have any more errors. And you can always filter to invalid rows. So if you're concerned about what those errors are, you can go ahead and filter there. And it's not going to let you submit until all of the errors are resolved. So that's the initial process that we've set up and made available here on the IMHIP website. So really excited to be launching this today, and you can do the same process for validating group locations and facilities. This is one step I think that we're really excited to be launching here. There's obviously a lot more to getting rosters passed through to plans successfully and having them updated. The goal of this is just to provide this simple tool that can be used to check your validity initially. I know Sam has a lot of future visions around connectivity and things like that. Even at the IMHIP conference where I got to come out and present this there was a lot of great feedback about things like success notifications and giving reports about who's actually in the network on the plan side back to the providers after the submission. So there's some great ideas there. Love to hear more of those ideas today, if possible, in the chat. But this is, we're trying to provide this simple, straightforward tool that gives you that transparency immediately before submitting to the plans. So yeah, that wraps up my demo for today, Lindsay, and presentation. Is there any questions in the chat, or where do we want to go from here?
There are. First, there was a suggestion when doing, and I don't know if you saw it, but when you showed all the fields and some had no mapping to them, if there was a way to highlight the ones that had no mapping, so you could.
That's a great suggestion. I will take that to the team. Currently, right now, the only way that you're going to be able to get that is just by reviewing the fields and identifying where it says select a column. If the column is a required column, I believe it will not let you move on to the verification stage unless you have that. So let me just double check on that real quick. So say I don't have a change effective date. I'm going to go ahead and try to submit there. So that I believe is required. Anything with the red dot is required. So yeah, it did let me move on to this stage, but obviously you see that those are all required there. And I think there is there might be a setting. I'll check with the team and get back to you. It's a great question, and I think that'll be really useful. There might be a setting that doesn't let you move on to that next stage, but I'll double check on that.
Yeah, I just think because there's so many fields, right? It's easy to scroll through there. So I thought that was a great suggestion. Okay, in terms of questions, our first question is, does the tool consider no answer an error, for example, for ADA criteria?
Would you be familiar with what you mean by no answer? So does that mean a blank value?
Yeah, I believe so. And I think it wouldn't be here. It would be in the actual, once you hit next,
Yep.
and you have where the red things were.
Yes. So let's just go back onto that.
And Amy,
So
if
it's
you
a
want
good,
to clarify, that was from Amy Cruz. Amy, if you could just clarify in the chat or the question box.
so, and I think I understand the question too already, but yeah, clarification would be good. But basically, if it's not a required field, then a blank value is sufficient.
Okay. So if it is a required field according to the roster and there is no answer, it would show up as an error.
Yes. Yeah, and I
Okay.
believe so we've mapped this completely to the IMHIP roster. So that scenario should not be valid according to the IMHIP roster. There should be a value that indicates there is no ADA or whatever the other type of field is. Um, there should be a value that indicates true, false, or yes, no, that it's not ADA accessible, essentially.
Yeah. And Amy, I don't know if this is answering your question, but I saw that you said, are all fields considered required fields or only some? So in the actual roster spreadsheet, in the instructions tab and in the actual tool itself, it will let you know which of those fields are required to be completed and which you can leave blank. So for instance, on the screen, oh, you just scrolled, like a CLIA certificate obviously is not going to apply to all providers. So that would not be a required field. So
That's right.
yeah. All right. And then our second question is, will this tool work for ABA providers, which Jake is a specific type of service, and they have specially credentialed providers. And sorry, Roberta, I don't know what the acronyms stand for, but BCBAs, who they have board certifications, but not a license. So I think that's probably more a roster question than um, a validation tool question, because the validation tool is driven off of the roster.
Yeah, I'd probably say that as well. So, yeah, it's a good question. And there might be those edge cases that this would not account for, but I'm assuming license is a required field in the roster. You'll have to forgive me. I haven't memorized all the rules, but I'm assuming that license probably is a required field. Is that accurate,
Yeah,
Lindsay?
you know what, because I don't have the roster thing open, but if you could put that in an email and send it over to Tierney at imhip.org, we can follow up with you on that. I know there's been a lot of issues around CBAs and rosters and pack registration and stuff, so forth. So we'll follow up with you offline if that's okay. So our next question is, how do you ensure sensitive information such as date of birth and social security numbers are secure?
So our product is high trust certified and HIPAA compliant, and we're not storing any of this data. So those are the main ways. It's a good question though.
Perfect. Yeah.
Yeah.
I know when you have high trust, you're in good hands. So thank you.
Yep.
All right. Next question. If a provider does not know what worksheet to complete, how will they know? Example, if I am a community mental health center, how will I know all the information I should include? Don, that goes back again to the roster completion, that spreadsheet, the original roster spreadsheet. It will tell you which of the fields are required fields when you complete that roster. So hopefully that answers your
Yes.
question. It's pulling
Yeah.
off of the roster. Actually, can you do me a favor, Jake? Could you go back to the IMHIP website real quick, just have it open there, and just go back to providers and we can show folks where to find the actual roster. Yeah. So this is a providers page. And if you scroll down on the right, you'll see the new universal, nope, next one down, universal IMHIP roster template.
Yeah, so that should be downloading there.
Yeah.
Yeah, so it's a great point. I think a really important one. We're not making any changes to the roster. It's essentially a mirror image of the
Right.
roster, but giving you that feedback immediately.
Exactly.
So yeah, these
So
are all the different
here's the
requirements there.
instructions on the roster. So this would be if you're a practitioner as a CMHC, you would be doing it under group location, but you can see in the instruction sheet which fields are required if you are contracting with the plan for Medicaid. So that'll guide you as to what needs to be included on the roster.
Yeah, so all of these are different notes and information for formatting and whether it's required or not. So yeah, all this is reflected on the validation tool.
Okay, so our next question is really more about the roster submission. It said, why did they go on making this portal instead of converting the roster as an online submission process? Veronica, that's really because the roster is a tool that is submitted to all the different plans. So from a operational perspective, you know, each plan you're going to submit separately. So doing it online on the IMHIP website would not get it to all the plans. So, and different plans have different timelines as to when they want them submitted and how they want them submitted. So, but definitely we can take that back. And, you know, we're always, as Jake said, looking for ways to improve the process. We can definitely take that back and think through how do we make this an IMHIP online submission as opposed to a spreadsheet that has to be filled out and emailed or submitted, however the plan requests it.
Yeah, absolutely. I'd echo that. And I think that is kind of in line with Samantha's future vision,
Yeah,
where this is completely seamless.
right. Yeah. I mean, we've made great progress in that there's a single tool for all 5 plans, which we know was not the case not that long ago. Here's a question, I'm not sure if you can, but is there any way to demo a facility roster? I think what you were demoing was practice, so like
I
a
do
hospital.
not have that. Yes, that was not part of my plan today. I'd be happy to follow up with you or whomever is asking that and do a one-on-one if you'd like. It's the same process, but yeah, I don't have that data available to test.
Nope, that's fine. So Claire, if you could just, again, send an email to IMHIP, we'll connect you with Jake. And I think, Jake, your email maybe was in your slides at the
Yeah, and
beginning.
then we can drop that in the chat if you'd like.
Yeah.
I'll type that out there.
Another great question. Does the validation tool account for empty fields that are required? So going back to that required field, if that field shows as blank and it's a required field, would that show up as an error that they need to correct?
If it's blank and it's a required field, then yes,
Okay.
it would be an error.
Oops, let me make sure. When you hit submit, who does it go to?
So currently it doesn't go to anybody. So that's essentially the end of the process is the report that you get. And eventually we'd like it to go to the plans, but we're just not there yet. But until then, you know, the end of the process, like I said, is that the report.
Right. So here's how I would answer that is, as a provider, you're going to fill out the roster. And before this validation tool was available, you would fill out that roster and submit it to the plan. And if there were errors in that, it would fail to load, and you're going to run into a whole bunch of issues with the roster load at the plan. So by using this roster validation tool, you can correct, have those errors identified, and you can correct them before it gets submitted to the plan. So once you've gone through the roster validation tool, you know that the roster that you are submitting to the plans is correct and has all the, required fields in the right formats and everything. So you're not going to get hung up with that roster being loaded at the plan. Am I characterizing that correctly, Jake?
Yeah, absolutely. Thanks for adding that, Lindsay.
Okay. Are the required fields the same for all provider types, or does the tool do any differentiation of what's required based on the type of provider or specialty?
Currently, they are all the same. Yeah, we're not looking at provider types.
Yeah, so if you're a practitioner, you fill it out as a practitioner. All practitioner required fields will be the same with group, same with facility. They're all going to be either required or optional based on the general provider type, not specialty as in primary care versus a specialty, if that's what you're asking me.
Yeah, we're obviously splitting it by, practitioner and facility, but yeah.
Okay, on the insurance company side, will they be able to go in and look at this as well? We have some companies that take more than 90 days. Will this be something that will help it get updated sooner? So I would say if you use this tool, the chances of it getting loaded more quickly are greater because you know that the roster you're submitting has all the required information in the right format. So I would say that, you as a provider using the validation tool once you've completed the roster is going to greatly help getting that roster loaded at the plan side, because there aren't going to be any errors that are getting the roster spat back at you.
Yep.
The roster is, these are all roster questions. I'm sorry, Jake.
Yeah.
The roster is universal. However, the last time I submitted, it seems each plan had its own requirements. Has this changed? The roster is universal. The plans are required to use and accept the universal roster. So if you are experiencing issues with a particular plan having its own requirements, please definitely get in touch with IMHIP so we can resolve those. Does this validation include highlighting if any data requires specific data and it is not in that format? For example, practice as field spec versus specialist. That's definitely a Jake question.
So yeah, I'm trying to make sure I understand what that's saying. So yeah, if I look at some of the instructions, we've taken these formatting requirements and implemented them in the roster. So if you've got, different date formats, those are all required to be MM, DD, YYY, YYY. So that's just one example, but there's other examples like, NPI needs to be 10 digits. Medicare IDs can be text / numerical. These date month formats all need to be in this specific, these time formats need to be in this specific format. So if it's not included in the roster instructions, it would not be included in the validation tool. However, there are things that we can enhance within the tool. So if there's useful aspects to that that are not currently included in the rules, we can take them back and look at implementing them in the roster. So
right.
Hope that answers your question.
So it sounds like it is going to highlight, if it's not in that format, numerical text, if it's text, it has to be in this format, it will highlight those.
Correct.
Okay. Dawn, let me go back to your original question, Dawn. What was your original question? Oh, so Dawn, maybe we can connect after this because I want to make sure I'm getting your question answered. Are you asking, so the worksheet is the roster. So the first thing you're going to do as a provider is you need to complete that universal roster template, which is that spreadsheet that Jake just had on his screen. Once you have completed that, so Jake, just from a purely step by step, they've gone in, they've got their Excel spreadsheet completed, this practitioner or group spreadsheet. That's completed. They save that. Then they go back to the website. How do they get that to connect to your validation tool?
Great question. So yeah, here's an example of what a finished roster looks like. So as you can see, like Lindsay was saying, we've looked at these instructions. We said, okay, let's put this data in the correct format. These are the headers that we include. Then my data looks something like this. This is, 800 rows. Your group could be, however many providers are practicing at your group. You want to make sure they're in the right format to check
This is the
on all of that.
actual roster. Yeah, so you've done the roster, you completed it. Yep.
Yep. Then you can come back to this website, click on this link here, open this, and then once this opens, you'll click drop files here or click to upload. So yeah, that's the first step, and then you'll go and you'll grab that actual roster. So that's in use, so you need to make sure it's saved but closed. You can click on that roster, and then might take a little bit of time depending on how big the file is, but yep, and then you'll kick off your process here.
Yep, very helpful. Okay, Tom Hartman, what tab do we use for super facilities and which for CMHCs? These are roster questions, so I can take that one.
Okay.
A CMHC is going to complete the group location tab. The facilities tab on the roster, and this is specific to your super question, the facilities tab on your roster is only to be used for organizations that bill for room and board services. So if you are a super residential facility, you would complete that facilities tab. If you were just a super outpatient provider, it would be the group location tab. So hopefully that answers your question, but that raises a question for me. If you are a facility or a group location where you are registering your organization, but then you also have individual practitioners, so like you're an FQHC, you're an encounter rate clinic, you want to register or put in the roster your organizational information, but then within your organization, you also have practitioners that you're going to put in the roster. When it uploads, is it going to upload both worksheets, the practitioner worksheet and the group location worksheet?
So that's a great question. So each of these buttons validate those different entities separately.
I missed those buttons down below.
Yeah.
Okay.
Yeah.
All
so
right.
you got a group locations, you come there, facilities, you go there. I believe it lets you select. So say if you've got all of that data in one workbook, I think you can select the specific worksheet within that workbook. But since this is only one worksheet, it's not letting you do that. But yeah,
right.
If
Yep.
if it's not picking up the correct one, so say you come into group locations and you are seeing it show your practitioner's worksheet, what I would recommend is just saving those worksheets separately before dropping them here.
Yep, perfect. We have a suggestion, and I'm not sure I fully understand it. So Amy, please, again,
Sorry, yeah, before I jump into that, I did want to show you. So I just uploaded a file that has multiple worksheets, and this is the view you get if you want to select
Got
a specific sheet within that
it. Okay,
workbook. Okay.
perfect. That's helpful. It says, make it possible for the provider to map any different roster templates to this tool
It's a
and
good
then store
question.
them
So,
for use.
and then do what for later?
It says, and then store the mapping for later use so they don't have to remap it every time they use it. Maybe you understand that.
I do. Yeah, it's a good question. So, part of our vision is to have the plans adopt this tool as part of their process. In which case, you would be able to accomplish what you're asking for. So, if your template, for example, has different field headers than the IMHIP template, what it will do is it will let you map those things. What it won't let you do is it won't remember those mappings, and it won't let you save those things. If there was somebody here who had a set of rosters that they wanted to sort of modify to that, we could work with you and help you modify your sort of non-standard template to the I'm hip template. And we could use this tool to help us do that. And it would definitely make things a lot easier. But it's not going to, have a history of what your mappings were necessarily. What I'd recommend is moving to the I'm hip template if you can.
Right. All right, thanks for that.
Mm-hmm.
Dawn, you had said that many providers do not know which worksheet to complete based on how they're licensed with the state. My recommendation is IMHIP does do webinars on roster completion, which walks you through, depending on your provider type, so that you know which tab to complete of the workbook. And those should be scheduled on the events page of the IMHIP website. They do them fairly frequently because it is a common thing. And then if you ever have questions too, you can also reach out directly to IMHIP and they can help you out with that. Another question, can this tool be used for all tabs of the IMHIP roster? For example, practitioner versus group locations.
Yes. And the way that we're supporting that now is through each tab has its own button here. So if you want to validate your facilities tab, you click on that facility button. Like I showed before, you can still drop your full template and select your facilities tab out of that template. So yeah, it can do that.
Great.
Yeah.
From Amy, excellent move in the right direction. Looking forward to seeing where this is and how it's integrated a year from now. So pat on the back. Ashley asked, can we actually submit from this tool?
Not yet. We're working on it.
Yeah, you'll still have to actually submit, the validated roster template to the plans. Getting a link to recording of this presentation. Tierney, I believe we send out a follow-up email with
Yep,
the
you'll
slides.
be getting it in the next 3 days, 3 or so days. We'll send it out.
Perfect. What 5 plans were you referring to that all use the new universal roster? It is all 5 Medicaid plans. So Aetna Better Health of Illinois, Blue Cross Community Health Plans, County Care, Meridian, and Molina all use this roster template for submission of provider rosters. Does this validation include checking the accuracy of the data or formatting only?
So this tool specifically is all about formatting and validity conformance. Our more advanced implementation, which does not include this, does have the ability to check accuracy. So it's a great question. Typically, our customers use that, our health plans who use that and check that and use our tool to help improve accuracy. But yeah, today, this tool that is now free for providers is just validity.
Yeah. Can an individual health plan require a provider to submit information that the tool does not require? I'd have to know a little more specifics around that, Nicole. So if you could send a follow-up email, that would be helpful. Oh, this is interesting. This is something we need to work on the roster. When completing the roster, it auto changes the date format to 7/1/2015, even though I enter 07/01/2015. How do I correct this so it won't show as an issue when validating? That's a great point, Megan. So I think that's something we need to take back and look at this Excel spreadsheet to see why, to prevent that auto correcting or change the date format so it's not creating issues for you. Great call out. Thank you.
Yeah, and I've thought that could be a challenge too. I think I might make the suggestion we allow the single digit month format. So yeah, January would just be a 1.
Yeah.
And et cetera. And we can do that in the tool. It's very flexible for those type of things. So we'll just have to coordinate with the IMHIP team on that.
Yep. Can you validate the roster as many times as needed, or is it a one-time report?
You can do it as many times as you'd like.
Okay, can you do a step-by-step process again from beginning to end? So can you just quickly run
Sure.
through? We have minutes left. I think we have time to do that.
No problem. So you come to the link, you drop your data where it says drop files here, or click to upload. You want to check and make sure you've got the right header selected. So you can see there that that row 1 has been selected where your headers are. Then you're going to review your mappings. So come through here, make sure everything that you have in your data source is mapped. If it's not, it will say select a column and you'll have to map that data. Everything looks good. You click next. Then you will get your validity report. Obviously, a lot of these issues are around date, but there's other checks going on that are behind the scenes here as well. You can export this data back to Excel that will include your error report. So that will look something like this. You can make those changes and you can resubmit this data as much as you'd like until it's clean. And then once you've cleaned it up, then you can shoot it over to the MCOs. And as Lindsay was saying earlier, that's going to improve how quickly your roster ends up getting ingested and the changes are reflected on the plan side.
Great. Question from a plan, County Care. How would the MCO know if the roster has been through this process? Is there any indicator on that roster that it's been through the validation tool?
Other than that it's a lot cleaner and more valid than the majority of the rosters you see, I don't think so. The other way would be we could work together with you and we can give you access to this tool on your side. So you can run all of your rosters through it as part of your process. And then we would actually integrate and automate how that data is sent to your systems. So that would all be, handled separately though.
Right, right. A follow-up question, and I think I know the answer to this. Will the tool increase accuracy of the data supplied, or are you verifying the information is submitted in the correct format? So I think
yeah,
uh,
this tool doesn't check against any third-party sources. Our product in general does that, but this is just one component of the product. And I'd be happy to schedule a follow-up call with whomever's interested to check out all of the accuracy and verification processes we can offer. However, that's all great. We can show you how we do that. But we also, timeliness is a huge factor of accuracy as well. So we anticipate this will continue to improve accuracy for Illinois provider data just by being more valid and allowing data to travel through the system more quickly.
right. Yeah, and I mean, the tool obviously is not validating that someone maybe mistyped their NPI number or, it really is just making sure that the formatting is correct and it's not going to.
Yeah, and I can pull up how we do the verification stuff just for illustration purposes. I've got a sample here. So one example, so this is our more advanced implementation of the system. But once, so say a health plan was using this, a bunch of our customers use this aspect of Convergent, but they take a roster. So that could be this file here, this record here from a roster. It gets auto matched to our reference data. So those are things like the DEA master file. This is a New York MMIS extract. So this gives us things like Medicaid IDs. And then we also have MPES here that was matched against too. So what this lets us do is sort of configure different settings that use various elements from those data sets to produce, that more accuracy enriched view of that data coming through. So, we're matching against NPI, so we get NPES NPIs. We got specialties coming in from NPES, so we can use that here. Medicaid IDs, etc. So I just wanted to, since there are a lot of questions on accuracy, I figured I'd bring this up. So that's not included in this validation tool. It's a more advanced version.
Yes, exactly. All right, last call for questions. I think we've made it through all.
Yeah, a lot of great questions.
We do have someone that said they once had a social security number that began with a 0. That leading 0 got taken out. Never heard of a social security number starting with a 0. That's interesting. Any other questions before we wrap up? Okay, well, thank you so much, Jake and Leap Orbit / Convergent. I think this is a really great tool. I'm so glad that it is now live and active on the website. A reminder, because there were a lot of questions about the roster in general, keep your eye out for roster completion webinars on how to use the template. Jake did put his email in chat, so if you have any follow-up questions.
Yeah. I think it went just to organizers and panelists though, so.
Oh, all right. Well, I will read it out. J Tunney, JTU. Oh, there we go. Thank you, Tierney.
Thanks.
And then feel free to email Tierney at imhip.org, TIERNEY@imhip.org with any other questions, suggestions, etc. And as Tierney said, all the materials and a recording of the webinar will go out in about three to 4 days. So you can hear us all again and watch the demo as many times as you want. With that, thank you so much to everybody. I always know it's a successful webinar when there's lots of questions and we have an engaged audience, and certainly did today. So thank you again, Jake. Thank you everybody for joining today, and enjoy the rest of your Monday.
You're welcome. And thank you, I'm Hip, for having us.
All right. Thanks again. Bye-bye.